Hi, everybody. This is Dr. Eliana Aaron from EmaCare. I'm going to be answering some of your questions today, as I did yesterday. We hope to continue doing this and to get to as many questions as we can. The first question is, if someone has coronavirus and experiences a cough or breathing issues that feels like bronchitis or pneumonia, should they go to a doctor? If you have coronavirus and you've been diagnosed, then any coughing or breathing problem should always be assumed, in order to be prudent, to be related to the virus. And that means you're not going to the doctor, you're going to call your doctor, or you're going to call the health authorities so that you can get the help that you need without potentially infecting other people. So when you have coronavirus, you are quarantined, because this is a very highly contagious disease. We don't want you to give it to other people, whether they're driving you to the doctor, whether they're sitting in the waiting room with you, or whether it actually is the doctor. In Israel right now, there are 55 health providers who are in quarantine because of situations like this. Another question, I understand that corona is dangerous if it develops into pneumonia. Is that true? And at this point, would penicillin help? The answer is no. Penicillin will not help. So pneumonia is one of the complications of coronavirus, but there are many life-threatening complications that can happen. The kind of pneumonia that this is a viral pneumonia, because this is a virus. It's not a bacteria. It doesn't all of a sudden become a bacteria. I mean, secondary infections can happen to anyone, but coronavirus is causing very complicated type of pneumonia called bilateral interstitial pneumonia. And it actually becomes sort of like an autoimmune disease. And that has to be treated with a lot of different kinds of medicine. And actually there's no consensus on how to treat it, but we do know that antibiotics don't work. So that's why it is so complicated. And that is only one of the potential complications that that coronavirus can give you. It can cause kidney failure, it can cause other organ failure. So don't try to treat this at home. Another question, can someone be reinfected by the virus? What we understand right now is basically that there are many types of viruses in the world. There are millions of viruses in the world. What we know is that when you get a disease like measles, mumps, those are all viruses, you develop immunity to them and you can't get them again. The exception is if you are immune compromised. So if you're immunocompromised, then sometimes you don't build up the same level of immunity as somebody else. Now, the exception to this rule is something like the seasonal flu, which mutates every year. If, God forbid, the coronavirus mutates, then we're going to have another problem, which is that it will be continuously changing and it will be hard to then be able to take care of it in an effective way. And in that case, just like the seasonal flu, you would not be protected from just having it, having a vaccine one time. So it is important to realize we are really hoping that this does not mutate, and that when we get vaccines, they will work and people will be immune. And when people get the virus, that they'll also be immune. Another question, what is the surface survival time on packaging? For example, if I get a box delivered from Amazon, how long should I wait before opening it? This is a really good question, and people have been asking this for a while. We do actually have some information. I'm going to just take a look at the source. This was published by Harvard Medical School. It's based on a study that was done through the World Health Organization, that the COVID-19 virus can survive up to 4 hours on copper, up to 24 hours on cardboard, so that would be the boxes from Amazon, up to 2 to 3 days on plastic and stainless steel. I've actually seen another study that said it could be even longer on plastic and wood. And in the air, it can actually stay for hours. And a lot of the issues with, how long it stays in the air has to do with the weather and the humidity in the air. For example, the SARS virus does not do well in the air when it gets too hot or too humid. So we're kind of hoping that the summer will help this one as well. Another question, I just came back from a quick trip to the Macolet, or the local store. The only person there was the storekeeper, and I realized after she was checking out my items that she was on the phone with her daughter, who was home with corona-like symptoms, which is a cough and a fever. If I was exposed to someone whose family member has symptoms, how should I disinfect myself? Should I shower? Should I avoid touching my face, etc.? So this is very challenging. We don't know, again, if that person that you're talking about, the daughter on the phone, has corona. She could just have the flu or a cold. So you're talking now about exposure to someone who then has an exposure to someone. So this is what I call the second generation exposure, meaning that you have someone who's sick, then you have the parent, and then you have you. So that's second generation away from the sick person. The Ministry of Health does not require quarantining. However, it's a good idea to practice really good hygiene all the time. So you should always avoid touching your face as much as you can, or only do it after you've washed your hands, and then wash your hands immediately after. As far as going to the Macolet, I just had to go myself, and similar issues, very concerning, and realizing that we don't know who's touching what packages of things as they stock the shelves. So actually, I came home and disinfected every package before I put things back in the fridge, and which is pretty much all you could do. The paper good, the things that come in cardboard boxes, I'm going to wait 24 hours before I do anything with them. They're just sitting in bags. That's just, you know, good prudent behavior, especially when you can't control what people are doing. You have to assume that everything anyone is touching could potentially have the virus. And that way you're always thinking in terms of disinfecting and being smart and prudent. So I hope this has been helpful. And the only other question I have is, someone said, do you have contact with a telemedicine doctor? And the answer is yes. EmaCare is doing telemedicine services, and you can see that on our website. I hope everyone is well, and I'll be back tomorrow to answer questions.